telemedicine has allowed me to, it's given me control over who I am as an endocrinologist, who I am as a physician, and I can take an hour with my patients, and I can take longer with my patients. I can let them feel heard. I can show them empathy. I can show them compassion. All of these things that you don't have to, just because you're virtual or in front of a computer, that doesn't mean you can't provide all of those things. And patients want to be heard.
Welcome to today's episode where we explore how telemedicine is revolutionizing care for endocrinology patients and reshaping the way women physicians practice medicine. I'm delighted to be joined by Dr. Munira Mehta, an accomplished endocrinologist and advocate for leveraging technology to enhance both patient care and physician well-being. Telemedicine has emerged as a powerful tool in endocrinology, offering patients convenient, accessible, and comprehensive care, often from the comfort of their own homes. But beyond its impact on patients, telemedicine has also become a game changer for physicians, especially women in medicine, helping to create a better balance between their professional and personal lives. Dr. Mehta will share how telemedicine not only improves care for complex endocrine conditions, but also enables women endocrinologists to thrive in their careers while embracing work-life integration. In this episode, we'll discuss the unique challenges faced by women physicians, from balancing caregiving responsibilities to navigating systemic barriers in medicine. Dr. Mehta will inspire us with her vision for how women can reimagine their workspaces to celebrate the privilege of being physicians while living fulfilling lives both in and out of the clinic. Her story underscores how telemedicine can support women in building careers that are not only meaningful, but also sustainable, allowing them to care for themselves, their families, and their patients. This conversation is a call to action for women physicians to support one another, embrace innovation, and advocate for creating work environments that prioritize well-being. Whether you're a physician, a healthcare leader, or simply curious about the transformative potential of telemedicine, this episode will leave you feeling motivated and empowered. I hope you enjoy the show, and if you're looking for any links to anything we discussed, check out the show notes. Well, Munira, I'm so excited to have you here. Munira is one of our own. She is one of our wonderful endocrinologists that joined our team this year, and she's just the best. And she takes such great care of her patients and has been a wonderful addition to our team. And we are here today to talk about telemedicine, how it has changed our lives, and the interplay between remote work and motherhood, and how, we're really interested in making endocrinology a desirable specialty for people to go into, medical trainees to go into, and particularly for women, as we know that 70% of endocrinology fellows are women, and we need to create environments where women endocrinologists feel supported and feel like they can take care of their patients in the ways that they want to, and also they can live their lives, because being a woman in medicine is a uniquely challenging and uniquely amazing also experience. So, Munira, tell us a little bit about yourself and what brought you to where you are today and your experience with telemedicine and endocrinology.
I'm so excited to be here, and I'm grateful to be part of this team. So, my journey started in fellowship. I finished fellowship about, I guess it's been 7-8 years ago, and I was in academic medicine for a couple of years, and then I transitioned into private practice, endocrinology, and I loved my patients, but I still felt stuck, and I felt like I wasn't the best. We weren't seeing the best of me. I didn't feel I didn't feel fulfilled in many ways. And so I had to really have a moment to myself, and then have a conversation with my friends and my family. And my husband said, you don't have to have a plan. You can step out of this. You need to kind of reevaluate your goals and what you want from your career and from your personal life. So telemedicine sort of I kind of landed in telemedicine, and I'll explain why. So I had been networking with people in the realm for a couple of years prior to leaving my private practice job, which was in 2023. And for one reason or another, I stayed in that role, but I realized that I needed to take a step back, not a step back, but a sidestep to be very intentional in where I wanted things to go. And then I left the job. I started talking with the telehealth companies, and I really found people who had these ideas and goals that resonated with mine, where I could provide high quality care and access to endocrine care to patients who would otherwise never see an endocrinologist and never get that diagnosis or never get high quality care. And so that's what landed me in the telemedicine realm. And I honestly thought about it as a bridge to go from, one job to the next, because like many other physicians, I was stuck with a non-compete where I couldn't practice within a certain radius. So I said, okay, I'll use this as a bridge to go from here to there. And it has translated into so many bigger and better things. And I've met some very, inspiring people along the way. And I've trailblazers almost, because we're trying to provide care and fill this gap, and where there's a huge need is what we're trying to meet, in that we're trying to provide care to patients all across the nation. And I've been able to do that. And I'm so grateful that I'm here.
Yeah, and I think to put it into perspective, 75% of U.S. counties don't have a single endocrinologist. And oftentimes those are rural communities or places that aren't desirable for people to go live. And so that's almost the whole country. Mm-hmm. Almost the whole country doesn't have easy access to care. And telemedicine bridges that gap for many people. Is it perfect? Absolutely not. Is it for every single doctor and every single patient? No. But what we've learned in the diabetes and endocrinology space, there's a huge, almost all of the population of those patients can utilize a fully telemedicine endocrinologist relationship or a hybrid of in-person and remote care. I think almost all of us, especially us working age people, would much prefer a remote visit if possible. And I think it's very important for us to recognize not just the clinical needs of our patients, like what do they need as far as the labs to check and all of that stuff, but also the social needs and the economic needs of our patients. And telemedicine does offer solutions from those non-clinical outcomes perspectives, but those also translate to clinical perspectives. And we also we had this worldwide pandemic, right? We had COVID that forced us to explore telemedicine as an option. And what we learned from it through studies, our own and in our own group, amongst our own patients, as well as other groups like the VA, that telemedicine outcomes in diabetes are on par and in some ways better than in-person visits. And patient satisfaction is very good. And actually, they're able to make appointments and they save money and they save the system money because, the VA gives travel vouchers. And so I do think it is a unique opportunity and an opportunity that we are obligated to explore with our patients. How do you think that endocrinology is uniquely suited for telemedicine?
That's a great question. I think, honestly, I think endocrinology and a lot of other non-surgical specialties lends themselves to telemedicine in some capacity or another, and to some degree even non-surgical specialties with like post-ops and pre-ops and consultations and things. But specifically for endocrinology, I think it's such a great tool, and I've developed such great relationships with patients, and I can say this with confidence. And I was a skeptic before, not going to lie, but once you're in the space, it's not about physically being in the room with the patient at all times, because it's sad to say, but with the constraints that are placed on physicians now with time, administrative burdens, and just documentation, all these burdens, the amount of time and the quality of care that you get in an inpatient visit is not always what it used to be or what it should be. But telemedicine has allowed me it's given me control over who I am as an endocrinologist, who I am as a physician, and I can take an hour with my patients, and I can take longer with my patients. I can let them feel heard. I can show them empathy. I can show them compassion. All of these things that you don't have to, just because you're virtual or in front of a computer, that doesn't mean you can't provide all of those things. And patients want to be heard. And it's unfortunate that that's not where a lot of clinics, and I'm not saying all physicians are like that, but I think it's hard to find the care that most patients need in this day and age. And I'm able to do that through telemedicine, diabetes care, prescribing so many medications, and having a multidisciplinary approach to care with a health coach and a diabetes educator. Sometimes even in my practices before, where I was in person, we didn't have such comprehensive resources to offer the patient. So it's not about, being in person or virtual. It's about finding the right fit and the team that allows you to deliver the best care, and people who care about patient outcomes. And we can do this not just with diabetes, but thyroid care, osteoporosis. It lends itself very well to care. And sometimes it's just diagnosing conditions or Cushing's, and it's a variety of things that you can do. And if I hit limitations, I'm the first to say, okay, look, I think you need to go to see someone in person, or you need dynamic testing that we cannot offer. And those things come up, but those are the exceptions rather than the rule.
Yeah, and I think that is the biggest thing that people get concerned about, is the relationship. Is it going to feel cold? Is it going to, have that same feeling as if we were in person? And I absolutely love seeing patients in person. I don't do it often right now because it doesn't make sense for my life and my career, but I love seeing patients in person. I love seeing people in person. We're here together today as opposed to being virtual for a reason, right? Like there is a benefit of being in person. There's the oxytocin rush when you give someone a hug. All of those things are very real. However, we have to weigh the risks and benefits. And with telemedicine and diabetes and endocrinology, even though there is perhaps some of that warm, fuzzy loss on that end, we have the ability to maintain eye contact with the patient throughout a 30 to 60 minute visit, which in a traditional setting, I just remember, and it makes me like gag to think about it. But in my old practice, I had a computer that was at standing level, and my body imagine my body like this, and then my patient is like sitting over there perpendicular to me, and I'm typing away, staring at the computer in front of me, and like barely seeing the patient out of my peripheral vision, or like turning my head occasionally, because there's no time to just be in front of the patient without documenting anything in that kind of setting. And so you're forced into this setting, and if the office setup isn't how
patient-centered,
it isn't patient-centered, and you don't get to decide how to set up your own office, it's this setup for a very cold
encounter,
right? And so, yes, I can understand that skepticism and that concern that people have about the visit being cold. However, I think the traditional delivery of care that most of us are experiencing now is extremely sterile, and we are able to connect deeply with people online in this day and age. And with endocrinology, where there's such a dearth of endocrinologists and there's such a need, finding ways to bridge that gap is imperative for our communities, the health of our nation, the cost of healthcare, all of these things.
I agree. And in fact, I find my patients they're a bit hesitant at first, or, I can tell from their body language when they first meet me, but I love that challenge, and I love putting them at ease and making them feel like I'm on their side. And it's sad, but not a lot of patients have experienced that. Like, we're there to empower them, and we're there to help them. We're not just here to play the blame game, or, they've experienced so many stigmas and traumas related to their chronic conditions that goes away quickly once you really, really just treat them as a person, not as the disease. And you can, I think, within the first few minutes, I do my best to set that tone, because that patient-physician relationship is so important. And in fact, I find that my patients remotely are so much more engaged, and they're very motivated because they didn't have to deal with the anxiety of, I have an appointment. Am I going to be late? I have to figure out my pickup and drop off for my child and carve out, 4 hours of my day to get to the appointment and back, wait in the waiting room. They're comfortable. They're at home. It's, let me do this. I'm not going to try to reschedule this. I can do this. So I find my patients to really be engaged in their care and tell me exactly what their needs are, and we do our best I try my best to meet them where they're at and provide the care that they deserve.
Absolutely. And I think in medicine, traditionally, we have done a bad job of valuing and prioritizing our patients' time. And that may be the physician, it may be the clinical staff, it may just be the kind of rigmarole that they have to go through when they go to a clinic, that we completely devalue a patient's time, and that their appointment might be at 1 o'clock, but they're not seen until 3 o'clock. This happens all the time. Everybody has experienced this, whether it's for themselves or a family member. And what that leads to is already a fractured relationship, because even if it's not the doctor's fault, like maybe they had an emergency right before, right? Or a patient that was really going through a difficult time, and that took more time than estimated, or whatever. The relationship is fractured before the patient even walks through the door, because they already, whether consciously or subconsciously, feel disrespected. And rightfully so.
Right.
They are disrespected. And with telemedicine, one, it helps us run on time, because we don't have to wait on an MA to check in a patient. Our nurse reviews the record beforehand and has everything prepared for us beforehand, or we review things ourselves. That patient's appointment time is when the patient is seen. Yes, sometimes we run 5-10 minutes late and we apologize to the patient, but it's never like you're sitting in an office for 2 hours, and they're in the comfort of their home or their office, so they can continue to work or whatever it is that they're doing, if they do have to wait that extra 5 or 10 minutes. And so telemedicine enables us to demonstrate to the patient that we value their time. We value not just their time waiting for us, but their time as far as a commute, and that they are the most important person in the room. Because I think some doctors, and I hope our generation is getting better, but I know that there are doctors who think they're the most important person in the room, and that's just not true. That I think that we have to believe that the patient is the most important person in the room. Otherwise, we can't provide the best care centered around them. And so, in a way, it sort of takes the ego out of the equation
Yes,
for the the doctor. Now, let's talk. Okay, we've talked about that skepticism with the warmth, the warm fuzzies of the telemedicine experience, and we've had maybe a couple of patients who haven't liked it, but we definitely the coolest thing to see is to see the skeptics change their mind, because there are certain people who aren't excited about telemedicine, but we're fortunate that they give it a try. And I like to talk to the patients about it, to just see what their experience is. It's important to me to make it the best that we can. And a lot of them will say, I was really skeptical and I wasn't crazy about the idea, but I tried it and actually I really love it now. Have you had that experience?
Yes, I think I see it every day, and I just see how relaxed and excited patients are to come to the visits, because we try our best to work around their schedule, and they can do it sometimes they'll, if they're home, they'll do it from home, and they'll provide me with the objective data that I need. And they love that they can be comfortable in a home environment, because oftentimes they're having very difficult conversations, and doing that in a space that's not their own makes it even harder. And so they love the convenience of it, and the fact that they don't have to drive 2 hours to get to the nearest endocrinologist, or they don't have to wait 9 months to see why they have, the symptoms that they're having, or if they have a diagnosis of thyroid cancer, they don't have to wait 6 months to see an endocrinologist, right? So they love, once they're part of it and they see the type of care that we give and that we're their champions, they love it. And that makes me the happiest doctor ever. And some of the best, administrative staff and MAs and nurses, diabetes educators that I've had and have worked with have been in this telemedicine realm. And I think it's because people are just more fulfilled, they're happier, and they are putting their best foot forward in providing care to the patients.
Yeah. And I think it also gives us that flexibility and freedom too, because I remember feeling extremely stressed out because I had no control over when my 1 o'clock patient was actually going to be in the exam room for me to see them. And it relied on so many different factors that were out of my control. And so, I was seeing my 1 o'clock at 2 o'clock and my 2 o'clock at 1:30. Yes. And it was just so discombobulated and confusing and just very difficult to stay on track. And sometimes you think, oh, these are little things, but they are stressful, and they get more stressful the busier you get. And that stress gets compounded when it happens every single day, day in, day out. And so I think with telemedicine, there's just this sense of control. And sometimes patients run a little bit late. They have technical difficulties. Those things happen, absolutely. And there's no perfect solution, but I do think that it offers patients and physicians a unique sense of control and connection that is actually extremely disrupted in our traditional system now. You mentioned something that I kind of wanted to circle back to, and it was the non-compete. And without getting into specifics of your particular situation, I would love to talk about that, because I know that there's been a lot of FTC talk about non-competes and the enforceability of it, the legality of non-competes. And I think it's very interesting because we live in a world where we as physicians provide a service to the community, and there's a shortage of physicians and a massive shortage of endocrinologists, yet in a community that needs physicians and endocrinologists, a viable, wonderful, board-certified physician is not allowed to take care of patients. I would just love to hear kind of your perspective on that and what it means for our community.
I honestly think it's unethical because we are doing a disservice to the community by not we're capable, we're willing, we want to be out there providing care. That's what we do best and what we love to do. But we have these handcuffs and we're not, we can't do it. And it's as simple as it is. You're putting dollars over the needs of the nation, of the country, of the community, and that's not okay. I mean, I could have driven out of my radius, but that would not have made me a better physician because it would have brought me back to the same position I was in 2 years, and that would have led to me leaving again. And so I needed, it's very disheartening to see that you're not allowing physicians to do what they want to do and what they need to do, what they're qualified to do for the greed or whatever drives these decisions. I think it's sad. And what it does more harm than good, because then either patients don't get care or they get subpar care from providers or people who aren't qualified enough to deliver specialty care or endocrine care, and leads to delay, and it leads to other morbidities and mortalities down the road. So I find it unethical.
And, I do understand the idea of a non-compete. Let's say you own a pizza shop and you learn all of the wonderful recipes from this pizza shop, and then you leave and you decide to open a competing pizza shop right next door. I can see how that might feel unfair to the original pizza shop. Okay, that makes sense to me. But when you're a physician, that group, especially in endocrinology, with surgery, maybe it's different because there's some hands-on training after fellowship and residency that different groups offer to their new hires. But in endocrinology, when you come out of training, you are a fully trained endocrinologist. There's nothing that you are learning from the practice owner or the hospital system that is an added value for you. They're not giving you something. They are perhaps helping get patients in the door. Absolutely. I see that. I mean, I'm a practice owner, right? I facilitate getting patients in the door for you and Dr. Alluri. I get that part of the puzzle. However, in such a shortage, especially in the insurance model, that actually is not that hard. I think most endocrinologists know that getting patients through the door, if they were to open up their practice and they accepted a lot of insurances, that actually wouldn't really be the challenge, especially if you're good. And so it really begs the question of, what is it that we are taking away from you? Yeah, we're taking away
patients,
potential business, but there's enough patients to go around for everybody. And it would make you try to be more competitive. But when they block you, a good endocrinologist from setting up shop, maybe not even next door, within several miles, it enables those systems to have a very low bar for their care, right? Because, well, not only am I going to give you subpar care, I'm also not going to let anybody else give you better care close by. So guess what? This is it.
Unless you want to.
Yeah, this is what you've got, and you're stuck with it, which, I think, yes, businesses do have to protect themselves, but there's also the beauty of healthy competition. And if somebody is doing a better job than you, then up-level yourself, raise the bar. And I think we are in an environment where the bar is so low. Sometimes when patients tell me things or tell me that they liked something about our practice or something that we did, of course I'm grateful and happy that we were able to provide that service. But I'm also like,
that's a given,
yeah,
right? Like we should be doing that anyway.
Yeah. Why is it so bad other places? Like, why can't you get anyone to answer your phone call when you're a patient of their clinic? And it's so crazy to me that the bar has gotten so low.
Yes. And it's from the constraints that are being placed on physicians. And it's not that they don't care or being in person translates to this every time. It's just there's too many other factors that are out of physicians' control that hinders their ability to provide the time and the nuanced care that the patient needs.
Yes, absolutely. What are some challenges you have encountered implementing telemedicine with your patients?
So I do telemedicine in a few capacities, and I think I should explain that because each challenge varies from one to the next. And in this, of course, with Hey Healthy and Complete Medicine, the patients are at home, and we provide excellent care to the patients. And sometimes they'll ask questions like, "Oh, I need this ACTH stimulation test," or "What's your waist circumference?" or body percentage, fat percentage, or RMR. And it's not that they're motivated. Our patients are motivated. And I circumvent this by just referring them to places where we can get that information and use it as objective data to before you start therapy and to monitor their progress and see where they're getting at. So sometimes that can be a challenge, but it's not a barrier to providing the care that we need to provide. So I have that time and I have the resources to be able to tell them, like, this is where you need to go and this is where you'll get what you need and bring it to me. And then we continue to provide the care that we need and make progress with our plan. So that's something. And then the other thing I think we should bring up and talk about is sometimes telemedicine can feel isolating because you're, by yourself and you have a team, but everyone's located in different parts of the country or the city or the county or the state. But I think finding the right team and finding the leaders who are there to give you a voice and to make you feel heard and your needs be met as a doctor is very important. And I urge anyone who's considering doing telemedicine is, be picky. Like there's a need for endocrinologists, and you can shape the narrative. So you decide what you want, and if that leader or that team can't give that to you, then that may not be the right fit for you. So you can work around that piece of feeling isolated or that piece of it by just being with the right team, because then you constantly have check-ins and you can make things better for your group and then also for patients.
Yeah, absolutely. I think what you touched on is in telemedicine, it's important in all types of care to view the doctor-patient relationship as a partnership. But in telemedicine, I think it's especially important because, they're not coming into the clinic with the lab in the same clinic and then, I'll send you downstairs for an x-ray or, it's not all in one place. So the patient does have to take some ownership of, we do facilitate. We tell them where to go, what to take, all of those things. But the patient does have to be an active partner in their care to be able to go to make their lab appointment or to do all these things that they're not hard, but the patient needs to recognize that they have to take ownership of those things. And I think most people do. And I don't think that in a traditional clinic, that the patient can just be completely passive and have a successful experience either. And we do have tools that we try to make the experience as easy as possible for our patients. And we actually Munira will be like, hey, do you know where my patient can get the best price on a fine needle aspiration? Because they need a thyroid biopsy. And then either I know or we do some digging and we find out for that patient, which does not really happen in a traditional setting. And so there are definitely workarounds that we do to facilitate that partnership and make it easy on our patients. But it is important for patients to come in expecting to have a role in their care and not to be passive about it.
I agree. And there are other, there are different types of telemedicine roles and positions where you are providing remote care and the patient comes into the clinic and there's a nurse who rooms them, and it's a very traditional system. The only difference is that the physician is not in the room with you. They're on an iPad in the room with you. And in that case, they can go downstairs and do their labs, and the process is similar. But you're right in that this situation, it's a few extra steps. But I find my patients to be so motivated, and they know that we're here to help them, and they're willing to do what it takes to get better.
Yeah, and I think we are also very blessed with amazing patients, and I think that is unique because I have worked in a similar environment where sometimes patients were in person with a nurse and I was the virtual aspect. And so I think that just tells us there's many ways to do this, and there's not necessarily one right answer or right way. And if we're creative and innovative, we can really find great solutions that work for our patients and ourselves. That's it for part 1 of this conversation. If you're enjoying the discussion, be sure to tune in for part 2, where we'll continue the conversation and go even deeper. Make sure you're subscribed so you don't miss it.